Let's talk to Labour MP for Leicester East, Claudia Webbe, who joins us now. Good morning to you.
Good morning.
Good morning. Well, it's a shock announcement last night after very lengthy meetings today. The Health Secretary held with representatives from Leicester and health experts about whether or not to put the city you represent into local lockdown. Do you think it was the right decision?
I do believe it was the right decision. There is nothing more important than life itself, and it's really important that we do take action to save lives. And actually, with the rate of infection and the data that was coming through now, albeit belatedly, it was absolutely clearly the right thing to do. But what I want to make sure that the government is seeking to do is not only to protect lives, but to protect livelihoods too. This is obviously such a serious and devastating decision to have to make for a city that has already had to endure the impact of coronavirus to date. But really and truly, we have to begin to ensure that people remain safe. And I think this was the right thing to do.
The right thing to do at the right time, because Sir Peter Soulsby, the Labour Mayor of Leicester, we spoke to him yesterday, going to speak to him again in about half an hour. He was saying yesterday, from the data he'd seen, it didn't look like there was any need for a local lockdown, and that actually you hadn't seen an increased rate of people needing to be hospitalised. And there seemed to be this argument in the city that, you'd seen an increased rate of infection simply because there'd been more testing.
No, it wasn't. Yes, there's been more testing, but it's really about the rate of positive testing.
Yeah.
And the rate of positive testing was in my view beyond what is normal, from what obviously I've heard and listened to throughout in Parliament as well.
Yeah, we understand it's about 3 times the rate. You said the rate of those who are tested in terms of what they're getting. We're looking at something like 3 times the rate of the next most affected city. Why do we think there has been a spike in local cases? I've seen various attempts at explanation, but nothing definitive. Presumably, the health experts have said to you what they think the problem is. What is it?
Well, they haven't really indicated why particularly there's been an outbreak in Leicester. Obviously, this is a virus that doesn't discriminate.
Thought we were told it did a few weeks ago.
No, what the socio-economic indicators discriminate, and of course Leicester is the last place that you'd want to see a virus, simply because we have, particularly in areas like mine, in my constituency, you'd have high levels of poverty in terms of child poverty being at 42%. Our average weekly income, even before this virus, was £160 less than the UK average, and we already know that the disproportionate impact that this virus has on African, Asian and minority ethnic communities. So Leicester is the last place we'd want this virus to occur.
So you think that the issue may well be about sort of deprivation in the area? Now, I understand it was identified that Evington and Spinney Hill, the 2 particular neighbourhoods, little areas in Leicester where we've seen particularly the spikes. Those are largely Asian communities living there. There's been some concern about people working in meatpacking factories where, of course, the conditions are rife, all cold and wet, and we've seen that in Germany and many other countries as well. But also whether a failure to or an inability to socially distance, given particularly Asian families often tending to live in sort of 3-generation households, the grandparents, parents and children, therefore making it much harder for people to perhaps social distance and to isolate. Do you think those are some of the issues?
Well, what you see, it's certainly nothing to do with communities, and we can't blame communities for this virus.
I'm not blaming communities. I'm asking for the reasons why. If there's a spike in a particular city, shouldn't we know why?
I just want to be absolutely clear that we can't blame residents and communities. What happens when a virus does take hold, that if you do have multi-generational and multi-occupational households, then of course it's going to have a more serious impact in terms of being able to control the virus. But it's not the cause of the virus at all. The cause of the virus has more to do with the government easing lockdown far too soon and far too early. We've been late in lockdown generally. We're a country that has as the UK, we have the highest rate per capita of deaths across the world. that wasn't inevitable. So in a sense, we've got to be able to address this issue as the country as a whole, and get this virus under control. Leicester will not be the last city where we'll see this outbreak. And in a sense, we've got to watch carefully to see how this outbreak at this localized level is managed, because other cities will need to prepare.
Yeah, absolutely. There's no doubt at all. I mean, this is what we were told would happen. This awful phrase whack-a-mole that the Boris Johnson, the Prime Minister, talked about. The people you've spoken to, the people you represent in Leicester East, are they largely welcoming of this? I mean, obviously they would rather there wasn't a spike in their city, but is their view, this is what's got to be done, we need to stay safe? Or is there a lot of anger and upset and worry about the fact, people were looking forward to, going to the pub and going to restaurants on Saturday along with the rest of the nation, and that they are now basically not just standing still, they're going backwards, non-essential shops closed, schools closed and the like? What's the reaction? Is it largely welcoming and understanding the reasons for the local lockdown, or is there anger?
I think you'll find that there are mixed feelings all around. I mean, communities are absolutely devastated by the fact that they're having to endure further lockdown measures. Of course, everybody wants to return to life as they knew it, as normal. And for particularly for those communities and businesses that have not had the support throughout this crisis, it is going to be particularly hard indeed. There were so many in my constituency that are on no recourse to public funds. That means that if they don't work, they've got nothing else to rely on in terms of support. There are businesses that have not had any government assistance during the crisis at all. The theatres are on their knees, and self-employed businesses, of course, have not had the support they need either. And we need to have the job retention scheme continue at the 80% rate as well. Otherwise, businesses are going to.
But we can't continue it forever. I mean, as businesses do come out, we can't continue it forever because the country will go bankrupt.
Well, I'm talking about for the period of the extension of this lockdown in Leicester, that there does need to be this continuation, because in my constituency alone, I'm already dealing with people that have received threats of notices, redundancy notices, and so it's really going to impact and worry people more. But people obviously are concerned for lives. They've already experienced deaths within the community, and so nobody wants to see any more deaths, and I certainly don't want to attend any more virtual funerals. So we must protect lives, but we must also protect livelihoods.
Claudia Webbe, thank you very much indeed for joining us, Labour MP for Leicester East.